We are going to learn anatomy. What exactly do you mean by anatomy? You know, when somebody is talking to us and we don't understand, what do you say? What that fellow talks Greek and Latin? I don't understand. Generally, that's what we say in India. But anatomy is Greek and Latin. Are you able to follow? No? Now let us see. Anatomy. Let us divide the word into two units. Ana and Tommy. Generally, when you talk about Tommy, what do you think? Tommy is the name of a dog or a puppy, is it not? But actually, Tommy means cutting and Anna means up. So it is up cutting. You understand? Here, whom are you cutting? Up the human being. That's why you call it as human anatomy. Is that fine? So anatomy means up cutting. When you go to the tailor and ask him to stitch a dress for you, so he's cutting up. Next time you observe. So this up cutting, here we are up cutting a human being, so you call it as a human anatomy. Okay? In this human anatomy, if you see the word Tommy, again we know about so many Tommies. The surgeons, with great respect for the anatomists, they gave the name Tommy for the procedures which they do on the patients. For example, appendicectomy. What do you understand? Cutting off appendix is appendicectomy. In the same way, you heard tubectomy, cutting off the fallopian tube. Of course, you don't cut and remove the fallopian tubes. You just cut so that you just cut a fallopian tube, and that is a family planning operation, and then you ligate the both ends of the cut tubes. In the same way, vasectomy. So now you understand, Tommy basically means cutting. Okay. Now let us go with the history of the anatomy. Who is the father of anatomy? If you say, Herophilus of Chalcedon. Herophilus of Chalcedon is called the father of anatomy because he was the first person who had dissected the human body. Not only he had dissected, but also he distinguished between artery and a vein. He also said about cerebrum and cerebellum. He also spoke about the meninges which are covering the brain, the parts of the eye, the duodenum, the prostate gland. So many things he had found out. So many things he had mentioned. And that's why we call him the father of anatomy. I have been telling you that anatomy is Greek and Latin. Are you believing what I am telling? Now you see, generally we say heart. That is in English, you call it heart. But in Greek it is called cardiac, and in Latin it is called cor. Now cardiac, study of heart is cardiology, and the person who practices this is called cardiologist. Coming to the blood supply of heart is supplied by coronary arteries, the right and left. So cor means heart, nari means of the heart. So the arteries of the heart are the right and left coronary arteries. Are you able to accept now? Then coming to another word, stomach. When you say stomach, that is English, but make it Greek and Latin, that is gaster and venter. Here if you see gaster, the artery of the stomach, gastric artery. The ulcer of the stomach, gastric ulcer. Understanding? Then what is towards the stomach or the aspect of the stomach called ventral. So this is the ventral aspect of the trunk, ventral aspect of the abdomen. Are you able to follow? In the same way, you have got so many other words. We have been using these words, but we are not aware that they are coming from the Greek and the Latin origin. Okay? Thank you. Why are we learning cutting the objects in different planes? Why should you? Now please understand, We are in an era of machine vision. Which era? Era of machine vision. What is there inside our body we can see by using X-rays, ultrasound, CT scan, MRI, and plane and contrast methods are there. You're understanding? When you want to know the three-dimensional image, then you have to define, for example, there is a tumor in the brain. Which portion? The right or left cerebral hemispheres or cerebellar hemispheres. Anterior to the coronal suture, how many centimeters? Posterior to the coronal suture, how many centimeters? You want to know the exact topography. You're understanding? For us to understand the three-dimensional image, we need to study these things, that is, these structures in different planes, so that you can understand them much better. Is that fine? And sometimes I have just said sagittal plane, or in fact we call it mid-sagittal plane or the median plane. Sometimes if you are taking cuts on the right side or left side in the same way, that is, where the plane is passing vertically, in such a way you get right and left halves, that's when you are cutting. But it is not exactly in the center, it is to one side, then it is called parasagittal plane. That is, it is parallel to the sagittal plane but towards one side, the right side or to the left side. Are you able to follow? Good. We are going to learn about the positions in anatomy. First of all, let us learn what is anatomical position. Then we will learn what is supine, what is prone, and what is lithotomy position. Okay, now what is anatomical position? A subject is said to be in anatomical position when he is standing erect, eyes looking forwards, the arms are hanging by the side of the trunk with the palms facing forwards. The palms facing forwards, lower limbs parallel to each other, great toe pointing forwards. Are you able to follow? Anatomical position means a subject is standing erect with the eyes looking forwards, upper limbs hanging by the side of the trunk with palms facing forwards, lower limbs parallel to each other, and the great toes pointing forwards. Are you understanding? Imagine if I am standing like this with my palms facing backwards. Is this anatomical position? No. Or if I am bowing down my head, is it anatomical position? No. Is that fine? Definitions must be aptly said, then only you will get full marks. Now coming to the supine position. A subject is said to be in supine position when he is resting on the back and looking up the roof. And coming to the prone position. What is prone position? When somebody is lying on his gaster or ventral aspect and then they are able to see the floor. You can see the person's back and the person is able to see the floor, and that is called prone position. And lithotomy position. What is lithotomy position? In this type of position, the person is lying on the back, but the legs, that is the lower limbs, are elevated and the feet are strapped. Especially this position is adopted for the ladies when the delivery is being conducted or the private parts, the vaginal examination of a woman has to be done. Then this position is taken by the gynec and obstetric patients. Are you able to follow? So these things you should know, because when you are working in the hospitals, so they will tell, keep the patient in supine position or prone position. So what exactly these are, you should be knowing.